So you're trying to land that perfect nursing job after graduation, and I am here to give you some tips. This is part 3 of my series, and I am a nursing professor and a former ICU educator and a nursing education manager, where I've interviewed a lot of new grads kind of coming into our ICU for residency programs. So these are some important questions. Typically, you're going to have a series or multiple questions around conflict. There will always be some type of conflict questions, or something where you have learned from a situation, and you need to have examples. So again, take notes in your clinicals of certain situations or in classroom settings, or this can be from a previous job, but you need to have specifics. So when you have either made a mistake or an error, and that could happen, so we've all had errors and mistakes. And also, have you ever taken care of a dissatisfied patient or a family member, and what was that about? Or have you worked with a difficult coworker or a difficult peer, and what was the conflict and how did you resolve it? So they'll ask you to tell me a time, and they will want specifics. So if I'm going to ask a question about, tell me a time that you worked with had a dissatisfied patient, you don't want to say, well, I've never worked with a dissatisfied patient, or I've never worked with, and so you need to be able to have a story, and it needs to have specifics. And you want to make sure you also talk about how you feel, because as somebody that's interviewing, we just don't want just a candied or a canned answer. And something that it looks like you've memorized. So tell the story. Bring some inflection, bring some feelings into it. Tell it how you felt about the situation, or how the person that you were working with felt. If you were working with a dissatisfied patient, what was their story? Why were they just so dissatisfied? Were they upset with their care because they were also sick and scared, and you could recognize that? So you want to bring in those elements of the situation to the whole interview question. So not only have specifics, but also talk about how it made you feel and how it made the other person feel, or how you think it made them feel. Also, never talk bad about the person or the situation. There's always a learning moment from all of these. And so if they don't ask you, what did you learn from it? What would you have done differently? You want to end that story with, after reflection of that situation, I've had time to think about how I would have done that differently if it didn't have the outcome you wanted, because some of them, they don't have the outcome you wanted. We're not looking for these perfect answers, but we are looking for the fact that you were able to reflect and think through them and give us an answer that shows that you had some growth and maturity about that situation and how you would have done things differently. Again, bring some, good stories into this. So think about them while you're in clinical. I promise you, you're probably, just when you leave clinical, every shift, just get a voice message on your way home, and just leave your voice message and say, this happened, this happened, this happened. And if it has specifics, give specifics. That way you can go home and jot them down later. I'm telling you, it's fresh in your mind. Do that, or you will not have a clue what to write by the end of the time you graduated, because you will not remember the first semester of nursing school to the end, and you're just going to give them stories from the end. And there's stories throughout the whole thing. So I'm going to go through some more questions and some more tips, but I hope this series is helping you and helping you land the job you want.